Hi, I'm Dr. Craig Castanet. I'm going to review some lumbar and cervical MRI films, teach you a little bit about the anatomy of the back and neck and what goes wrong, what degenerative conditions occur, define them for you, try to provide you a better understanding of them, and then tell you how we provide non-surgical treatment in a unique and I think more efficacious treatment than most clinics. Let me show you this lumbar MRI scan over here. These are various slices of the low back area. You may have had a lumbar MRI scan. These slices are to orient you. This is the back, for example, of this person. This is the front. This is their lumbar spine. These here, there, these are the discs in between the bones here, here, and here. All these. In the low back, the lowermost sacrum, which sits between your pelvic bones, is right here. The lowermost disc is the L5-S1 disc, because by convention we call this L5, or the fifth lumbar vertebra, and this is the top of the sacrum. We refer to the top part of the sacrum as S1, so this disc is named according to the bone above and below. So this disc is the L5-S1 disc. You can see it's white in color. Now we're going to go to the disc above. You see it's darker in color. This disc is the L4-5 disc. There's a vertebra above that. This disc is the L3-4 disc. There's L3. There's the L2-3 disc. That's L2. There's the L1-2 disc, and that's L1. Let's look for a moment at the discs generally. You'll note that there is a lighter color to this disc and this disc. It's a little darker there, and it's light again there. In these particular images, the light color denotes more water content of the discs. These two discs have lost some water content, so they're what we term degenerated discs. They have also lost perhaps a little bit of height, though not a lot. Sometimes you'll see that these have lost so much water content that they will collapse and you'll have bone on bone. That's not the case here. But let's also look behind at the back part of the disc. You'll notice that the fibers of this disc are in continuity from the end of one vertebra to the vertebra above. This one seems to stick out a little bit. This is a bulge or herniation. The one above that is sticking out considerably, so that's a pretty good sized herniation. If we go over to this other slice here, and the reason we look at numerous slices is because some slices will depict the problem better than other slices. But if you look at this slice over here, this disc is sticking out significantly. This is a very large disc herniation at L3-4. If you look at the disc below, this has got a little bit of white right there. That tells you there's a little bit of a tear in there with some inflammatory water content. This is the L4-5 disc. We call this an annular tear. You'll hear numerous terms used in your MRI report if you read it, or if you hear it described by a doctor, and I'll explain some of those terms in a moment. This disc is good. It's not sticking out in the back. That's the L5-S1 disc. It's got good water content. So if this person were to come in and had back pain, the likely source of pain is this and more likely that. Oftentimes there's more than one problem. In this case there are two. Sometimes you have to try to figure out what the source of the pain is, whether it's arising from one or more discs. That's not always easy to do. You correlate what you see on the MRI scan with the person's clinical findings to determine what you think the source of the pain is. That's especially important if you're contemplating surgical treatment. It's not as critical if you're going to treat somebody non-surgically. So I'm going to take this one down and I'm going to show you another lumbar MRI scan here. This is from another facility. The images look a little different, but they're also quite similar. Again, different slices to see different things. Let me point out a couple of things with this. The contrast in this image is such that you have a good picture of the spinal cord, which ends right about here. Then you see little tiny lines. These are the nerve roots. They continue on down the canal. You'd like this space, this white space here, to be as wide as possible. That width provides lots of space for the nerve roots to descend and to exit out the little holes on the side and continue on to innervate, the buttocks, thighs, legs, and feet, and they're responsible for all the functions of reflexes, sensation, and motor or muscle function. In any case, if you look at these discs and vertebrae again, you can see that in this case, person has good white discs there and there, there. These have good water content. They're also not sticking out into the canal here, so they're not bulging or herniated. If you look at the one below, this disc and this disc are quite dark. It so happens that they've also lost some height, although not severely so. And they're sticking out a little bit in the back there and there in this particular image. Also, you notice in this one, there's some white here in the bone. Oftentimes when there is disc herniation or disc pathology and you don't have proper exchange of fluids across the end plate to the bone and the disc itself, you'll get what we call modic changes or swelling within the bone itself that shows up as white in color also. So this particular vertebra has a deformity. Instead of having a nice kind of a flatter or smoothly curved end plate or bottom, it's got this sharp demarcation up into the body and down, that sharp pointed jagged area. That depicts a fracture of the end plate there, and as a result, that bone is not happy, it's swollen, and you notice that in the MRI scan. Let me tell you how we treat these things, and let me review a little bit of additional anatomy here. If you look at, in this particular slice, you see these holes here. These are the little holes on the side of the vertebra, and I'll point these out on a three-dimensional model in a moment so you can see where the little nerves exit. I don't know if you can tell from this image, but there's a little nerve root, that little gray matter right up there that's going to exit out that hole. That's true right there and there and there, and it's harder to see right there. Sometimes the images are not exactly the same because the person may have a little curvature in the spine or such, but I just wanted to point out these little foramina, which is plural for foramen, which is little holes on the sides from which nerves exit, one on each side at each level. Sometimes you'll see a herniation that will stick up into that hole where the nerve exits and make it smaller and pinch the nerve at that level. More typically, it's down this central canal where nerves get pinched on the side as the nerves exit underneath the disc and come out the side. I'm going to point out some anatomy on a cervical MRI scan.